That's the only homework you've got, this one thing. But let me caution you, by the way, nobody's done this so far, so I think I get nervous towards the end of the course. It's like a 200 question test, so don't skip it. So there's quite a few of you out there that skip like what did I learn today, or a TED Talk, and if your grade is high, it doesn't do anything to you, really. It's 10 points. But 200 points would be like skipping 20 of those. So just don't miss the big stuff, because that'll tank you, right? It's even better to do it really badly than not do it at all. Okay, although I prefer you do it really well. That would be even better. All right, let's present this. Hold on one second. Boom, 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 boom. Okay, so here we see a lovely human being. Let's go through here in the back of a lovely human being. Do you guys see how the hamstrings go across the knees on both sides? And the gastrocnemius comes across and goes across the knees on both sides? Kind of cool. And how the glutes weave down into the IT band and all that good stuff. It's beautiful. Okay. So we're not going to go over gory detail over all this stuff, but what's cool about this chapter is you're going to notice that it's asking you some of the questions that I've been asking all along. Like what muscles attach to the scapula? What muscles attach the scapula to the thoracic region? And that's the muscles of scapular movement, right? They attach your scapula to your body, and that is the trapezius, right? And levator scapula, rhomboid, serratus anterior, and pectoralis minor. Don't forget about pectoralis minor. It's in front, but it's hooked to the scapula and back. Yeah? Yes. So on this list here, which muscle on this list likes to work with the upper trapezius? Because it does similar stuff. Doesn't always, but which muscle here?
Levator scapula?
Yes, sir. And which muscle here likes to work with the middle trapezius?
Rhomboids?
Yeah. And which muscle here likes to work with the serratus anterior?
Pec minor?
Yeah. Good answer. Pec minor's in front, serratus anterior is actually in front, and they pull the scapula in front and down. Awesome. Good. I'm loving this. All right. We're not going to go into all that because I will take up all your time. Okay. So those were muscles that attach the scapula to your rib cage, essentially, right? Or your spine, depends on which ones. There are muscles that attach essentially your arm to your scapula, really, right? So we've got 4 rotator cuff muscles. Who can tell me what your 4 rotator cuff muscles are? The muscles that go from my scapula over to my humerus and kind of tie it together. Anybody? 4 rotator cuff muscles. They are up on this slide.
Infrapanatus, tele major, tele minor. Oh.
No major.
Oh, no major. Oh.
That's okay. So infraspinatus was right.
Yes.
Teres
Minor.
minor. Yep, those two go together. And then what else?
In spine.
Yes, kind of supraspinatus.
Supraspinatus. And sub something. I don't know.
Scapularis.
Scapularis.
That was good. It's hard. Scapularis.
Scapularis.
Subscapularis. Good.
Infrapanatus, tele minor. Supraspinatus.
Supraspinatus.
Subscapularis. Yes.
Subscapularis.
Yes.
Good. I love what you just did there, Miss Sarno, because what she just showed us is how you study. She didn't just get the answer right, then she went back and said it all again, so it's in her head properly. What were those 4 again, Miss Sarno, by the way?
Infrapanatus, tele minor. And suprapanatus, bawah subscapula.
I love it. Cool. On top of those muscles, everybody, we've got a beautiful muscle out here that looks like an upside down triangle. It's got an anterior, middle, and posterior portion. What muscle is that?
The deltoid.
The deltoid, yes. Can you tell me some of the actions of the deltoid?
Abduction. AB. Abduction.
Yeah, I love that she said that first because it does lots of stuff, but that's really the first thing I want us to think about, right? Middle fibers do abduction. Yep. What do the front fibers do?
Extension.
Nope, front fibers. Opposite extension. Extension would be the... Well, I'm so sorry, ma'am. I cut you off. What? So, rear fibers give you an extension back. What's the opposite of an extension? Starts with an F. Flexion.
Could you not hear me?
No, I couldn't hear you.
Oh yeah,
And I'm like,
I
oh, poor thing.
flexion.
Oh, okay. You got it. Good. Okay. Awesome. Thank you. And sorry, no, I couldn't hear you. Anyway, that's good. Okay. And then remember the latissimus dorsi is kind of weird because it leaps off your back. It does attach to the inferior border of your inferior angle of your scapula, but really it just leaps off your back and goes right over to your arm right away. So it does help tie your arm to your body, not exactly to your scapula. And what is the major action of latissimus dorsi, everybody? There's actually kind of two big things it does, and they're almost the same thing as far as we're concerned. Anybody?
Do you mind repeating the question? I'm sorry.
I do not mind at all, sir. I can actually think of three actions that the latissimus dorsi does, but two are very identical. I will take any of those actions as an answer. But what does latissimus dorsi do? Like if it contracts, what does it do?
If it contracts, if it contracts, it pulls you up, yeah, right?
Yep, that's absolutely true. 100% correct. It is your pull up or pull down muscle. I love that. So you're right, sir. What do we call that? What is happening to my arm? Not this part, but what's happening to my arm when I do a pull up or a pull down?
You abducts, right?
Yes, it is an adduction or
Adduction. Right?
or an extension.
Both. Extension. Oh,
yeah.
Sorry. I wasn't looking at the screen.
No, you're doing great. That was really good. The point is it gets my arms back down the side of my body. Yeah, very good. Good stuff, everybody. I'm feeling pretty good about this now. Yeah. All right. Fly through some of that. There will be review questions in here about flexion, extension, rotation, all that stuff. I want to remind you of something you guys will see on your end of your year test, and you'll see it in other anatomy books. So, can you guys see me? Watch this really carefully. Who can tell me what action I am doing now? I'll show you again. Yes, Mr. Blygen.
Is that medial rotation?
It is all day long, sir. No, you nailed it. It's really hard for some people to see because my arm was up. But really, you also see this in books where they have the arm bent. They're doing that. The arm has nothing bent, has nothing to do with it, but they want you to see what's happening. This is a medial rotation. This is too, by the way. It's just hard to see that, so they'll put the arm out here and they'll do that. Well, that's the same as this. This is medial rotation because you put the person in anatomical position, and that's what they're doing. It's medial, and it's the same muscles too that do this medial rotation. Like it still works. Does that make sense? Yes, Miss Routson.
Could you then demonstrate a lateral rotation from that?
Yes,
position?
ma'am, I could. So here's one from here, lateral rotation, right? That's lateral rotation. But also this is. Does that make sense?
Yes, thank you. I just wanted to see it.
No, I'm glad you did. So anyway, sometimes you'll see pictures of that and people get all confused because for one thing, the arm's bent and they think it has something to do with the bent arm. The bent arm is just to help you see what I'm doing. There's nothing happening here. Remember, there's no motion here, so there's nothing happening. You can't even say this is a flexion or an extension. This is just my arm bent. But there's a rotation happening at my shoulder, right? Cool. Mr. Blygen, you did really well with that question. I don't feel like you were challenged enough. So I have a follow-up question for you. What muscles were responsible or could have been responsible for the medial rotation that I was so kindly showing you?
The anterior fibers of the deltoid.
Oh, that was a good one. Yeah. They run diagonally. I didn't even think of that off the top of my head. They run diagonally and they could have been, in this situation maybe, but it doesn't matter. The fact is you're right. Anterior fibers of deltoid. Bam. Nailed it. Anything else?
We got the pec major.
Yes. Good one. Okay. There's two more that I can think of.
We're looking at the serratus.
No. Doesn't
No.
hooks to the shoulder blade only. Doesn't it would move the shoulder blade, but not the arm.
Oh, I'm looking at it on the screen here too, but I was not trying to.
I can give you a hint if you want. I mean,
Well,
not even if you want, if you need. If you're struggling, sir.
Well, I'm looking at the answers now, so it's unfair. So, subscapularis.
Subscapularis, that is the rotator cuff muscle, and that's what it does all day long. It does medial rotation, absolutely. And then there's a muscle that doesn't follow Tapscott's rules, because normally I say stuff in front of you flexes you or immediately rotates you and stuff in back extends you or laterally rotates you. But there is actually a muscle in back that can medially rotate you because of how it hooks into the arm.
So the latissimus dorsi, because
Yeah.
it hooks.
Because it goes underneath your arm like this, sir, it grabs here, and so it can pull my arm in. Yeah, good. That was really good. There's a lot of stuff there. Now I feel like you're challenged. We can move on.
Mentally.
Okay. Biceps brachii, brachialis. Oh my gosh, brachioradialis, triceps, anconius. Oh my gosh, all sorts of fun stuff. Okay. Some of these, by the way, will not make sense to you because we haven't learned about them. But what muscle is this on top right here? That's right, Miss Mejia. I'm going to be like, I'll be able to read lips by the time I'm done with this class.
Bicep brachialis.
Yes. What's underneath it?
Brachialis.
Brachialis. What's way underneath it through the bone?
Tricep brachialis.
Yes. What is this little strange muscle coming off down here? Kind of hard to see on me, but it's actually coming off down here and going all the way down to my thumb almost.
A crew.
I think you just almost said it.
A crew.
It's brachio
Brachio.
radialis.
Radialis.
Cool. Yeah. And I don't know, did we even learn about the anconius yet, everybody? Good. Okay, don't worry about it. Anconius, by the way, is a tiny muscle down in here that acts, we're going to learn about it later when we get to the forearm, that acts kind of like a tricep, and it's a weak elbow extender. So my tricep's the thing that lets me really extend my arm, but there's a tiny little muscle here that helps too called the anconius. And then the pronator teres, and don't worry about this, I don't even think they'll be on the test, I just kind of want to let you know since they're up here. The pronator teres and pronator quadratus are muscles that are in my forearm, one distal and one proximal, that help me to pronate, to turn my arm over. And your supinator is another muscle that helps you to turn your arm up. By the way, there are actually two muscles that supinate your forearm. One is called the supinator. Does anybody know what the other muscle is that supinates your forearm? It is a muscle you've already learned about. It's a powerful supinator. It's why you don't have another muscle named supinator, because this other one's even more powerful. Do you guys want a hint?
Is it the biceps?
Biceps brachii. That's why my bicep does this, is because it is supinating right now. That's why people, when they flex, they don't usually do it. They will sometimes. They'll do it like this, but watch the peak change. You can actually see the muscle go in more. Yeah. It's cool. Anyway, so your bicep brachii is a powerful supinator, and it's part of what you use when you supinate, when you use a screwdriver or turn a door knob or whatever. In fact, we designed screws and doorknobs, I don't mean me personally, but to use a supinating action because you guys are stronger supinators than you are pronators. Because you've got a big muscle up and you supinate. So stuff that gets screwed in and has to turn really hard, it goes in that direction on purpose. It's not an accident because you're stronger at supinating than you are at pronating. Somebody was thinking. I like it. All right. Okay, and we're not going to go into all this stuff. This is about forearms. We're not going to get into it. But what type of muscles are found on the anterior side of my forearm? What action do they do in general?
Extension. Flexion.
Flexion. Flexion. Yes. What? It was a terrible joke. No. What are the ones on the back side? Extension. Yeah. Cool. They either extend your wrist or your fingers. I understand there's some exceptions to that. But there are no exceptions in the sense there are no flexors in back and no extensors in front. All the flexors are in front, all the extensors are in back. It's just kind of cool, and we will learn them later. We do it, but we do it right at the end of the course. And we do that not because hands aren't amazing, they're totally amazing, but structurally speaking, you can have a problem with your thumb and it doesn't mess up your low back. And so structurally speaking, it is the least important thing we study, and that's why we put it towards the end of the course, because you guys start to burn out at the end of the course a little bit sometimes. Yeah. So if you burn out early, we want you to kind of coast past that. Okay. Let's go past all that. There are so many forearm muscles, you cannot even believe. Hey. If a muscle has the word pollicis in it, it goes to where? Your thumb. Every time. And there are 8 pollicis muscles. Thumbs are very tricky. There's 4 in your hand and there's 4 up your sleeve, so to speak. Cool. All right, let's see. What do we got? Okay. A lot of really big words here, but you guys know these, right? Psoas major and the iliacus, we usually refer to them together as the, yes, Miss Estes, beautifully mouthed.
Iliopsoas.
Yes, ma'am. What is the main action of that muscle? What does it do?
Flexes the hip.
Yes, 100%. Thank you. That's exactly right. Flexes the hip, so it could cause an anterior tilt, but its job is to flex your hip. To either lift your legs up or pull your torso over. I love that. Thank you. Who can tell me what muscle group the piriformis goes with and why I should care about this muscle? As a massage therapist. What?
Does the piriformis go with the quadriceps?
No.
No. Is it the adductors?
Nope. You're
No,
thinking
okay.
pectineus.
Oh, am I? Maybe you should repeat the question. The piriformis goes with the. Oh no. Is it the calves?
Nope.
Piriformis. That's in the legs, right?
Kinda.
Then it's in the hips.
Yeah.
That's why I said quads. So the piriformis.
Whoa. Now, the quads aren't in your hips.
Well, no, originally I said quads because I thought it was up in your legs. So the
Oh,
piriformis.
yeah. You're right. Your quads are kind of close by.
Okay, so the piriformis, I'm saying peri as in hips, then, right? Is that the
Sure.
peri parts?
But what muscle group does it go with in the hips?
Oh, must be the outside, so the adductors.
No.
Damn it! I'm not gonna get this. I'm past.
Would you like a clue, sir?
Yes, please.
Okay. It has 5 other muscles associated with it, so it's part of a 6-pack of muscles. And they're very deep in the hip. These 6 muscles. They're very deep, and there's 6 of them.
I can't think of that group's name. I thought I had said it, but because I said
Michael,
okay.
can I?
Yes, please.
They're the hip rotators,
Yep.
external hip rotators.
Lateral hip rotators, yep. External is valid too, what she's saying, but lateral hip rotators, and they're also referred to as the deep 6, sir.
Okay, I was close. I just couldn't think of the name, so.
Well,
Lateral
okay,
hip rotators,
so that was the
okay.
first part of the question, though, was what group they go with, and the piriformis is part of the deep 6, which is the gemellus superior, gemellus inferior, obturator internus, obturator externus, and quadratus femoris, and piriformis. Why do I care about the piriformis?
Are you asking me or anybody else?
Well, anybody, absolutely. If you want me to ask you, I will, sir. It's up to you.
No, I need to study clearly. So,
Okay.
yeah.
Miss Vincent, why do we care about the piriformis?
Because it can pinch the sciatic nerve.
Yes, piriformis starts with a P, pinch starts with a P. It can pinch the sciatic nerve. Exactly. Cool. Good job. All right. What is the tendon of the tensor fascia lata? I've never asked this question this way, but I think you guys can answer it. What is the tendon of... Yes, Miss Mejia?
Are you talking about the IT band?
I sure am. The IT band in a real way is the tendon of the tensor fascia lata. Like all muscles have a tendon that attach it to bone, and it goes down that thing and gets across your leg and attaches into bone. So yeah. And I was just asking it to see if you understood that concept. You did. That was great. Cool. What muscle group is the rectus femoris part of? Yes, Mr. Blygen. Sir.
You said rectus femoris, right?
I sure did, sir.
The quadriceps.
Yes. What are the other 3 quadricep muscles?
Vastus lateralis, medialis, intermedius, and rectus femoris.
Beautiful. Which ones of those cross over the knee?
All of them.
Thank you. I was just like, no! Yes, all of them cross over the knee because all of them help do what? What's their main action that all of them do together?
With
the knee.
The knee, it flexes the knee, extends it.
Yes, it extends the knee. Good catch.
Always get that. Well, yeah, you know.
So they all extend the knee, and that's including the rectus femoris. What else does the rectus femoris do?
The rectus femoris, it does a anterior tilt of the hip.
It can, absolutely. What's another way to call that? Like, what action is that?
A flexion of the hip.
Yes, good job, sir. Thank you. Anterior tilt was very legitimate. I just want to make sure we got both those in there. I don't want you guys to always think of it as a dysfunctional muscle, right? Like, it also just lets me lift my leg up. So that's cool. Awesome. Thank you. Who can tell me what muscle group the sartorius is part of?
Yes, there's none.
Oh, there's none. And I look, Miss Sarno went. Very good. Yes, there is none. Excellent. It is a diagonal muscle. Remember, it's on top of all the quads. You run over it all the time. And it's your hacky sack muscle, right? Lateral rotation, flexion of the knee, flexing the hip, all sorts of cool stuff. Yes, sir.
I feel like I use that muscle when I try to put my socks on when I'm standing up.
Yeah.
Is that accurate?
That is accurate. You can't sit cross-legged without this muscle. Like, I shouldn't say that, actually. There's other ones that could probably compensate. But it is the muscle that lets you literally lift your leg up and cross it over. And I can see you doing that when you're doing socks, right? You're kind of lifting one leg up and trying to bring it up to you so you can put your socks on while you're hopping around the room.
So someone who has an issue with like sitting crisscross or anything, would that be because the sartorius is tight or it doesn't have a lot of flexibility in it? Or would it be
believe it or not,
something more than that?
No. If they're having a hard time sitting cross-legged, that's actually probably not tension in the sartorius. Sartorius gets you there, but tension in the sartorius would actually make it hard for you to do the opposite of its actions. Like extend your leg and extend your hip and medially rotate and do the opposite of what it does. that make sense? Yeah. But I like how you're thinking. It's good stuff. What muscle group is the semimembranosus part of?
The hamstring.
Yes, ma'am. What muscle group is the gracilis part of?
Hip muscle.
What did you say?
Hip muscle. Hip.
Not exactly. Gracilis is part of a muscle group. It doesn't, I mean, kind of, but. Anybody out there?
Adductors.
Adductors. Cool. Gracilis, yeah. So there are 3 muscles that come together and insert into the proximal medial portion of the tibia to form something that kind of looks like this as they all come down in. What is this called, and what 3 muscles make this up?
It's called the pes anterinus. It's
Yeah.
the sartorius gracilis, and I believe the semitendinosus.
Bam! Woo! Good job. Thank you. All right. And we just talked about the popliteus the other day. That's the key that unlocks the knee. It's behind your knee, and we haven't even gotten to it yet, but that's what it is. I'll see if they have a picture. No, maybe not. There's the iliopsoas, iliacus. That's a good picture. Anyway. Don't forget the gluteus maximus that inserts in the IT band, because it has a lot to do with low back problems. I just want to see if that a popliteus here. No, maybe not. That's okay. Okay. Yes, sorry. Yes. Miss Mejia, please.
Is there any difference between muscles that say quadratus and the other Q that's the 4 quadriceps? Is there? I mean, I know ceps means head, but is that the only difference between quadratus and like quadriceps?
Yes. If I understand your question correctly, yes. Quad means 4, and quadriceps means 4 heads, and quadratus means 4-sided.
Okay.
Right? So
Yeah.
So yeah, they're both starting out with quad, but it really is one's ending with sides and one's ending with heads. And that's the only difference in the naming. Is that what you meant? Like just the way we talk about it? Yeah. There's huge obviously differences between the quadriceps and all the other quadratus muscles, because they all do radically different things. But anyway, yeah, there's no connection there as far as I know.
Okay.
Yeah. Sorry. If a muscle has the word holosis in it, it goes to where? Not polysis, but holosis.
Would that be the toe?
It would be the toe. Yeah, good job. And there are 8 toe muscles, and they all have the word holosis in them, so it'll be very helpful later. Cool. And what are the 6 muscles that can be found in the posterior compartment of the leg?
Are we talking about the calves?
Calves are 3 of those muscles, sir. So what are the calves? And they're the most superficial of the 6 I'm talking about. So what are the 3 calves?
The gastrocnemius, the soleus, and the plantaris.
Excellent. Which one or ones of those cross over the knee joint as well?
The gastrocnemius.
Yep. And what's the second one? Gastrocnemius is the important one, sir. It's the big structural one. But
Soleus.
Well, you had a 50-50 chance. It's plantaris.
Wait, it crosses over you said over the knee, correct?
Yeah. All of them cross over the ankle. All of them help me with the dorsiflexion of my foot, but the plantaris is way the heck up the leg, and it actually crosses over the knee. Yeah. And the reason that's significant is it means the plantaris and the gastrocnemius can not just perform a plantar flexion, they can also do what to the knee?
Medially rotate?
How about flex it?
Mm-hmm.
That too.
I need the picture.
You need a picture? We'll get to one. We really will. It's going to come up right here. And then we discovered recently that there were 3 muscles underneath there. Can anybody tell me the 3 muscles that are underneath? And this will complete the rear leg, at least, you know, just talking about the names of it. Mr. Mark's like, no, I cannot tell you that, so I won't call on you. Yeah. I can give you a hint that will really help.
Tibia, posterior.
Yes, keep going, Ms. Sarno.
That's the digitorum longus, flexor hallucis longus.
Yes, yes. Well done. Thank you. And we will study those again. Not again. We haven't even studied them, but we're heading down the leg right now as we speak. Let's see if I can get a picture for Mr. Blige, you left. I was getting a picture for you. Okay, sir.
I'm trying to make sure my apartment's not burning down with air fire. But look,
you can see the gastric nemeus here, right? In this picture. Yeah, maybe. No? Okay. This tiny, I'm not joking about this too, this tiny little strip of muscle up here between the 2 places of the gastric nemeus is your plantaris. And it's actually going across the knee. I wish we had a better picture. Let me see if I can show you better. I don't think I can. Not in this slide. But anyway, it is underneath the gastric nemeus and it's right here, if you can see my cursor. And it goes all the way down and goes into the heel. By the way, fun little fact about the plantaris, it has the longest tendon in your body. Plantaris is about the size of my thumb. It's way up in the knee, and it's got a tendon that goes all the way down to my ankle. Yes, you raised your hand, sir?
yeah, so where it crosses over the knee, that's like the popliteal area.
Yes.
So we don't necessarily, will we be able to like massage in that area since where all the nerves and stuff are?
Yeah, thank you. It is an endangerment site, right? It's your, like you said, it's your popliteal region. It's your knee pit. What you do is you just don't go straight in there. You go to the sides like this. It's literally is kind of an intention of your angle. So don't drive into the back of the knee. Drive to the sides. Just like if you were rubbing my arm, you wouldn't drive into my armpit. You'd drive into the walls that make up my armpit. Does that make sense? Mm-hmm. And you can do that 100% all day long. Totally fine. Yeah. Mr. Riedel, you had a question, sir?
So the plantaris tendon is longer than the like IT band?
Damn you. I doubt that it is, sir. Okay. I don't think a lot of people actually would consider the IT band the tendon of the tensor fascia lata. I just thought it was a good way to kind of make that point. But depending on how we define it, sir, and literally just how we want to make the rules, but you're absolutely right. If I'm going to call the IT band the tendon of the tensor fascia lata, then the plantaris is the second longest. But actually, I don't think people actually call the IT band the tendon, so that's why the plantaris got known as having the longest tendon.
Okay.
Yeah.
Makes sense.
Very good point. Very, very good point. Oh, I wonder if, well, we'll get into this later. All right. And I think that we're not going to get into feet muscles today. Yep. Oh. Nope, we don't have to do these. We haven't done those yet. Good. All right. I think, just want to make sure I didn't skip anything that you're going to have to go over. Do you remember the suboccipitals, everybody? It's a good picture of them. Yep. By the way, your book calls them the headache ghosts. I've actually never heard that before, but we do call them the headache muscles. Lots of people do. When somebody has a headache, I mean, it's one of the first things you think about working on is their suboccipitals. First thing. Then you start branching out, but it's, I've had clients, honestly, that are migraine sufferers, have me work on their occipitals for an hour. It's ridiculous. My fingers are just like, afterwards, just lay there and work on them. But they love it. They love it. All right. Oh, yes, Ms. Sarno, please.
Sometimes it's out of hospital and they get tired and get headache and they shoot inside the eye.
Yes. Yes. That's exactly right. They get a tension headache back here and it comes around their head and it goes inside their eye because, by the way, everybody, a lot of the nerves for your face come out of your neck down there. Well, not even your neck. They come out from underneath your head, basically, and they feed all this area. And so when it gets tense back there, it causes all sorts of stuff. Yeah, very true. Yeah. Can somebody tell me what muscle group the rectus abdominis is part of? Yes, Miss Bahia, that is correct. So, Miss Bahia, you guys make me very happy. What are the abdominal muscles? Please name all 7 abdominal muscles.
I don't think there's 7.
There isn't.
So you have rectus abdominis, transverse abdominis, internal obliques, external obliques, and then you have quadratus lumborum.
Yes, that's awesome. Very good. Yeah. What's the main action of the rectus abdominis?
Flexion of the vertebral column.
Beautiful. Flexion of the vertebral column, flexion of the spine. It's really flexing like, 20 joints at once, but it's the spine. Yeah, vertebral column, dead on accurate. What's the action of the quadratus lumborum? I feel like I'm going to need a bilateral and a unilateral answer for this one.
Weak spot. I don't know those actions super well.
Well, guess. I don't mean it's snotty. I meant guess. I think you might surprise yourself. Give me, if they both work bilaterally, what would they probably do back there?
Extension?
Extension of the spine. Absolutely, yeah. Yep. And so unilateral, just one side going.
Lateral flexion?
Yeah, lateral flexion, which also is, by the way, just remember everybody how like a flexion in front of your hip can be an anterior tilt. Well, the lateral flexion could also be an elevation of the hip, right? Because my hip is coming up or my side is coming down, but the fact is it's an elevation of the hip. So if your QL was tight on one side, you really would have an elevated hip and you'd be off. And you might look at me and be like, hey, his shoulder is elevated. Anytime you see an elevated shoulder, by the way, look down at the hips. It does, not because it's always the hips, but you want to figure out. Some people, you look down and their hips are perfect. And you're like, oh, it really is just a shoulder problem. Other people, you look down and you go, oh, they don't have a shoulder problem. They've got a hip problem. So kind of cool. Good. Excellent answers, by the way. Where do I find the rotatories and multifidi? Multifidus is apparently how your book likes to say it. That was adorable. Yes. Can you describe that location?
Up the spine.
Up the spine, and I love, she did a little shoelace thing, except hers are inchworms. They're cute little inchworms. It's like, do I find them, are they superficial or deep?
They're deep.
Yeah.
They're very
deep.
Lamina?
Yep,
Yeah.
they're deep in the lamina groove underneath like the spinalis and longissimus and stuff like that. Beautiful. Thank you. Hey, Mr. Blygen, where does the longissimus insert? We talked about this yesterday, you and I. That's why I'm asking.
Not occipitals? Occipital ridge.
Yes, kind of. I mean,
Up there.
yes, the
nuchal
line. But
that
what else?
thing.
Yeah, what is that thing?
Not the masseter, the mastoid process.
Thank you, sir. Good. Mastoid process. Can anybody else tell me the 3 other muscles or 2 other muscles that you've learned about so far that insert into the mastoid process? I missed little bits, by the way. I'm sorry I didn't see you.
The sternocleidomastoid.
Sternocleidomastoid, yep.
Also, I want to say I don't know if it's the levator scapula. Does that go up in there?
No, you said that yesterday too. The levator scapula.
Scalenes.
No, that's actually scalenes are by the levator scapula. How about splenius capitis, that thing that came off your spine and goes out at an angle? Boom. And then, for those of you that are in the suprahyroids, the digastric too. Yeah. Good times. Hey, Miss Lobitz, what are you grateful for today? And we missed you. And I'm sorry you're eating, but I had to ask you anyway. Because I missed you.
I'm sorry I was late. I had to be at my dad's doctor appointment, and the doctor was an hour and a half late. So, but I'm grateful to get more resources to help him and just get things in motion to make it easier on me. So,
yeah, it's a lot when you're caring for somebody else. Well, there's no need to apologize. I think you were doing the right thing with your time and stuff, but you were missed. Yeah.
Well, thank you.
Thank you. Thank you for being here.
I miss you guys.
Okay, let's go in here. We've talked about the diaphragm a little bit. Remember the internal and external intercostals? Yeah? If you like to eat intercostals, what do you like eating? Ribbies. They're ribs. They really are. So when you guys eat rib meat, you're eating intercostals, and the external intercostals go this way, the internal intercostals go this way, and if you flip your ribs over, you really will see fibers running opposite directions diagonally. Because cows and pigs have intercostals too. Yes. Oh, that's right. Who can tell me the name of the 3 serratus muscles? Anybody? Mr. Placencia, please, sir. Come on down.
We have the serratus anterior, serratus posterior superior, and serratus posterior inferior.
Beautiful. The serratus that's in front, the serratus that's in back up top, and the serratus that's in back on the bottom. That's what he just said. Beautiful. Sir, what are the actions of the serratus anterior?
The actions of the serratus anterior are to depress the scapula.
Yep, pull it down, and one other thing it does, even more so than depressing. You are right about depressing.
Oh, and to abduct I don't remember.
It's okay. It is to protract, to actually pull my scapulas forward, right? Or abduct them away from the spine. That's the same as protract. Cool.
Okay. So I was going to say.
Good. What are the actions of, I can only think of one, by the way. What is the action of the serratus posterior superior?
They elevate the rib cage.
Elevate the rib cage. Why the hell would I want to do that?
For forced inhalation?
Yeah, exactly. And then what does the serratus posterior inferior do? Quickly.
Just joking. It does the opposite. It depresses the rib cage.
Pulls the rib cage down for a forced exhalation. Yes, that happens naturally, but when you're running, you need to do a forced exhalation so you can get air back in you quickly. Beautifully done. Really good, sir. Thank you. These are very deep muscles, too. These are deep to almost everything we know in the back. Okay. That